Hi everyone, I'm Dr. Andrea, and I'm one of the veterinarians on Best Friends National Shelter Medicine team. Today I'll be presenting From Fade to Flourish, a guide to nursing fading kittens back to health. Fading Kitten Syndrome is not a disease. Rather, it's a collection of signs of illness in one or more initially healthy kittens that gradually become lethargic, ill, and eventually can die. This presentation will cover detecting early signs for timely intervention, explore potential causes, delve into treatment options, and highlight preventative measures. The highest mortality rates occur in the first 2 weeks of life, and ultimately the prognosis of these kittens depends not only on the severity of the conditions, but also the promptness of our intervention. Signs can vary and can broadly encompass one or more of the problems you see listed here, including lack of weight gain, weakness, lethargy, hypothermia, lack of interest in nursing, sleeping separately from the litter, whining, pale gums, vomiting, diarrhea, excessive crying or agitation for greater than 20 minutes, decrease in the writing, rooting, and suckling responses, constant distress noises, labored breathing, and lack of meowing or other signs. And though these signs are pretty nonspecific, they all warrant immediate attention. Normal neonate kittens spend most of their day sleeping, but when awake, they should show strong suckle, rooting, and writing reflexes. These reflexes enable kittens to reach a nipple and attain the correct position for nursing. And weakness or lack of these vital reflexes can be a sign of both birth prematurity and a kitten that is not thriving. Prompt attention and intervention is needed if these reflexes are weak or absent. Daily weight measurements are critical for early detection of illness. Kittens should be weighed at least once a day and monitored closely for weight gain or weight loss. In Fading Kitten Syndrome, concurrent hypothermia, meaning low body temperature, and hypoglycemia, or low blood sugar, are both common. Primary hypothermia, due solely to exposure, is most common up to 3 weeks of age, whereas hypothermia secondary to other stressors such as systemic illness, cachexia, and hypoglycemia may be seen in kittens as old as 6 weeks of age or more. Measuring rectal temperature is essential. If a kitten's core temperature drops below 90 to 92 degrees Fahrenheit, digestion and nursing will halt, and this can lead to regurgitation and aspiration pneumonia if kittens are not warmed prior to manual feeding attempts. Oral feeding is only indicated when body temperatures reach 97 degrees Fahrenheit. Prognosis for full recovery is good if hypothermia and hypoglycemia were not too prolonged and if primary predisposing causes are correctable. Care should be taken not to warm kittens too quickly to avoid overtaxing their depressed cardiopulmonary system. Warming should occur gradually over 2 to 3 hours. Here's a chart from the Kitten Coalition website that summarizes normal kitten temperatures based on age and gives nest ambient temperature and humidity recommendations. The syndrome encompasses a range of factors that can affect kittens, with causes often correlating to their age. Hypoglycemia and hypothermia are most commonly observed in kittens up to 6 weeks of age. Neonates are extremely vulnerable to congenital defects, maternal neglect, nursing failure, neonatal isoerythrolysis, and environmental stresses. The most significant threat to kittens aged 1 to 6 weeks is bacterial sepsis. Viruses, parasites, and weaning stress are more prevalent concerns for kittens aged 4 to 8 weeks of age. Now, let's touch on each of these causes a bit more individually. Thermoregulation begins around 3 to 4 weeks, but may take up to 6 weeks to fully develop. Environmental factors such as cold temperatures, overcrowding, and unsanitary conditions can impact kitten health. Genetic anomalies like cleft palate, internal organ defects, diaphragmatic hernias, hydrocephalus, and feline neonatal isoerythrolysis can all contribute to Fading Kitten Syndrome. Regular weighing of kittens can help identify issues early on, if not noted on examination. Bacterial, viral, and internal and external parasite infections can lead to a failure to thrive. Proper hygiene, sanitation, and parasite control are essential preventative measures. Inadequate milk supply, failure of passive transfer, meaning the kitten did not ingest enough colostrum for immunity, mastitis, and traumatic birth experiences can all affect kitten health. And once again, early detection and intervention are key for all of these factors. This chart from the Journal of Feline Medicine and Surgery shows how these factors and various pathways contribute to critically ill kittens and can lead to death. Many of these factors, when caught early, can help prevent the cascade before sepsis or death ensue. For kittens failing to thrive, immediate supportive care and treatment are indicated and include rewarming, correction of dehydration, and blood glucose support. Other additional support, such as antibiotic administration and parasitic control, may also be indicated and included as warranted. Because effective and intensive treatment is essential for positive outcomes, foster care is one of the most effective programs for providing the necessary support to these vulnerable kittens. Having a standard operating procedure is vital, and staff and fosters alike should be trained on the process. Kittens that fade do so quickly and need prompt intervention for the best chance of survival. In the shelter or clinic, this means starting treatments immediately based on the assessment and following the SOP while simultaneously issuing a foster plea for an experienced foster. Similarly, if a kitten begins to fade while in a foster home, the protocol should be implemented immediately and as follows. Step 1. Get the kitten warm. Make a kitten burrito. Turn a heating pad to low, cover it with a towel, place the kitten on the towel and roll the heating pad and the towel around the kitten. Place another towel around the outside of the heating pad. Leave the kitten's face exposed and do not remove the kitten from the burrito as you administer treatments. Care must be taken to ensure that kittens do not become hyperthermic or too hot, and temperatures should be monitored once the kitten starts responding. Step 2. Raise the kitten's blood sugar. Pour either corn syrup, Caro, honey, Nutrical, or warm water sugar into a small bowl. You'll need to administer this sugar substance with a syringe to the kitten while he or she is warming up in the burrito. Do not remove the kitten from warmth to give the sugar mixture. Give the kitten about 1 drop, 0.05 to 0.1 mL, every 3 minutes. Step 3. Rehydrate. Sub-Q fluids can be administered at 10 to 15 mL per pound. The syringe of fluid can be warmed by submersing it in hot water, like a baby bottle, but do not microwave it. Step 4. Alert the medical team or foster office that you have a fading kitten. It can sometimes take hours for a kitten to recover and start acting normally again. This is one situation where in uncomplicated cases, it's not advised to take the kitten to a local vet if the kitten has a dedicated foster. Fosters have the ability to make the kitten their top priority. A vet clinic has multiple patients who need help and won't be able to give the kitten the undivided attention fosters can give them. The kitten will continue to be cold and hypoglycemic on the way to the vet, in the waiting room, and in the hospital while determining what is wrong. Most kittens won't last long enough for them to begin treatment. Their best chance of survival is in foster care, with the foster parents administering supportive care. Once stable or stabilizing, then it's important to seek veterinary care. Unfortunately, even if all these steps are employed as outlined, some kittens just won't make it. Young kittens are extremely fragile. If a kitten passes in care, it's no one's fault. These kittens would have had a slim chance of surviving if it wasn't for trying. the focus should shift to taking the best care of the littermates. The deceased kitten may be needed for diagnostics to aid the organization in a diagnosis and help shape treatments for the littermates. Here's a great algorithm from Best Friend's online resources outlining the initial treatment steps to take, while also helping quickly discern which kittens are and are not treatment candidates. If I haven't mentioned it enough, in terms of priorities, the first task is always to initiate supportive care for stabilization. The second is to perform a detailed physical examination. And the third priority is to try to determine the underlying cause and to adjust the treatment if required. For those critically ill kittens in the clinic, this is an intensive flow chart detailing both diagnostic and therapeutic treatments. Again, it's important to remember that immediate supportive care takes precedence over diagnostic approaches, as we know these kittens are suffering from hypothermia, dehydration, and hypoglycemia, and need the 3 steps of intervention prior to pursuing diagnostics. This clinical trial demonstrated a high success rate in treating Fading Kitten Syndrome with plasma or serum therapy in cases where failure of passive transfer was suspected or known, in order to provide protection to kittens at risk for developing septicemia. Sepsis is the leading cause of death in neonatal kittens in the 1 to 6 week age range. Failure of passive transfer is an important cause of sepsis in kittens, but certainly not the only cause. Other contributing factors are poor nutrition, environmental stress, and concurrent illness. The simplest conditions can domino to sepsis in kittens, so astute observation is required. Bacterial sepsis frequently affects entire litters, with kittens falling ill and perishing within a few hours or days of each other. For this reason, it is common to empirically administer antibiotic therapy to provide protection for kittens at risk for septicemia. Treatment duration should be a minimum of 2 weeks. Nutritional support is usually required using assisted methods such as tube feeding or nasogastric tube feedings until kittens are strong enough to begin eating on their own. Survival is low in kittens that are showing clinical signs of sepsis, particularly if dyspnea or difficulty breathing is present. But prognosis for littermates that appear healthy at the time of therapy initiated is good. And once again, daily weight measurements of neonate kittens is critical. Proper daily care and feeding, excellent cleaning and sanitation, and close monitoring are essential for prevention. Daily weight checks, parasite control, vaccination, and veterinary follow-up are necessary. And here at the bottom of the screen is a kitten weight and feeding chart from the Kitten Lady website. As always, remember that this is a guideline. Not every kitten will follow the weight chart exactly. We're looking for trends that the kitten is making progress, thriving, and not declining. In the event that they are failing to gain weight or losing weight, immediate intervention and veterinary care is needed. To summarize, Fading Kitten Syndrome is not a disease. It's a collection of signs of illness. Fading Kitten Syndrome has various causes and requires early recognition and early intervention for successful treatment. And having an SOP in place to detail supportive care is really essential. Prevention through proper care and monitoring is key to kitten health and survival, and this is why dedicated foster homes are life-saving. Ensuring that fosters are aware and prepared for this potential syndrome will help to increase the success rate of saving the tiniest lives. I want to end by saying thank you for your time, and please don't hesitate to reach out to us if you have any questions or need help. I've included our shelter medicine email here if you need it. Thank you.